Morning, Mr. Jones. I was reviewing your chart and saw that you had called in regarding an issue you've been having going to the bathroom. So the note talked about you've been going more frequently than you normally do. You've been waking up at night to go, and you feel like you have to go back to the bathroom just after you've gone. So just wanted to talk to you about some possibilities of what might be causing your symptoms and then what we can do about it. So this morning I'm going to talk to you about your prostate and how we can see if this might be what you're experiencing. So first, what is your prostate? You may have heard about the prostate. It's a common thing that's talked about in medical commercials. You may have heard about it with some friends, especially if they're a little older than you. But your prostate is a gland that sits just below your bladder, and there's a tube that runs through the prostate that takes the urine from your bladder through the prostate, through your penis, and then to the outside. So the prostate surrounds that tube, and it helps with things like ejaculation and semen production. So this is a little picture for you that you can take a look at with your prostate, the tube running right through it and then going to the outside. So just to give you a little visual of where it sits and kind of what its function is. And then what are symptoms of prostate enlargement? So a lot of the things that you just described to me. So if you're going more frequently than normal, if you feel like you have to go right back to the bathroom after you've just gone, waking up at night, and that may be as little as one time every night, up to 4 to 5 times a night in a little more severe cases. If you feel like you do have to go right back, that's something we call incomplete emptying, where you still leave some urine in your bladder after you've just gone. And sometimes that makes you feel like you have to go right back. If you have a weak stream, or sometimes if it's hard to start your flow, or if you have dribbling at the end of your flow. Some of the other ones that we do see are painful ejaculation and some blood in your urine and semen. But the first ones we talked about are the most common. So what are causes of prostate enlargement? So there are 3 main ones I want to talk to you about. First one is BPH. What that stands for is benign prostatic hypertrophy. So that's the most common one that we see. And what it is just growth of your prostate over time. There's a thought that it may be caused by hormone changes. As we age, the prostate enlarges. So it's a non-cancerous enlargement of your prostate. The second one is prostate cancer. So that's kind of the big scary one that we hear about. It is the second most common cancer in men, only behind skin cancer. And it's fairly common in older men, but it's also a very slow growing cancer. And there are a couple of different forms of it. It can stay right inside the prostate, and it can eventually spread, but typically it stays inside the prostate, and it's a very slow growing cancer that kind of mimics the symptoms of BPH, like we talked about just a minute ago. The third one is prostatitis. So that's an infection or inflammation in your prostate, and it can take 2 primary forms. It can be acute, which is short-term symptoms that you may come in with and say, hey, these just started within the last couple weeks. Chronic prostatitis is lasting more than a few weeks, and it's still that inflammation or infection of the prostate, and we treat those with antibiotics. So the last part, what can I do about it? So the first part of that is talking to me, your provider. So we want to figure out what kind of symptoms you're having, see what category that you may fall into, and then go about a treatment that's going to make your life better for you. So the first couple things are, in the past, we used to do screening for prostate cancer in pretty much all men, and that included a prostate exam, which you may have heard about, maybe even experienced a little younger, and then checking what we call a PSA. So that's a prostate-specific antigen. And that's a marker in your blood that elevates as your prostate enlarges. And so we're able to check that, see if there's an enlargement. And based on how high the PSA is, you can fall into more of the BPH category or a prostate cancer category. So now the American Urological Association, the American Cancer Society, and another task force we have here in the United States that creates screening guidelines for us to use recommend against checking the PSA in all men unless you fall into a couple categories. So the first one is if you're between the ages of 55 and 69. So you're still a little below that, a couple years. And then even inside that category, we only check if there's an indication for it, which means if there are strong symptoms, if there's a strong family history of prostate cancer, or if for your peace of mind, you really do want that checked. Below that age, if there is a strong family history, or if you have had prostate cancer yourself, then sometimes we will go ahead and screen. But at this point, I don't think you fall into that category. And the reason that it's safe not to do that is when we look at kind of the process of prostate cancer and the slow growing nature of the cancer, a lot of times the risks of doing not the screening itself, but then determining if it truly is cancer, and differentiating between what we call a false positive in the PSA and a true positive. Sometimes the process of really finding out if it's prostate cancer is worse than the slow growing prostate enlargement. So that's something that we can talk about in the future, but at this point I think you fall into a category of what we call watchful waiting, which means we'll pay attention to your symptoms. If they're not getting better with treatment, then we can definitely look at doing some of these screening, and then we'll kind of take this step by step instead of jumping in and doing the full screening right now. The next thing is treatment. So there are a couple different categories of treatment that we do. Medical treatment falls into primarily two different medications that we can help with your symptoms right now. So the first one is medication that relaxes the smooth muscles in your bladder and your urinary system and allows you to urinate more easily. The second one is a medication that actually shrinks your prostate over time, but it does take a little bit of time. So those are two things that if you would like to pursue treatment in the future, we can do that. The best thing to do right now, I think, is to look at some lifestyle modifications. So avoiding things like caffeine or caffeine-containing products, which includes tea, sodas, chocolate. Those kinds of things can increase your need to go to the bathroom. So if you can try to limit those, cut those out when possible, that may help with your symptoms a bit. And then start doing these two things I'll tell you about. So avoiding every 2 hours. This just makes sure that the urine volume in your bladder doesn't build up too much, which can worsen your symptoms. And then doing what we call double voiding. So going to the bathroom, going back 5 or 10 minutes later, and then re-voiding to really empty your bladder fully. So why don't you go ahead and take this, keep a log of how many times you're going to the bathroom during the day and at night, and what food or drinks you may be consuming that may be contributing to that. Talk with your wife about what we talked about today, and then when you're ready to make a decision on treatment, we can talk again. Thanks, Mr. Jones.